lot quicker than we wanted them to be, which lets us know that autonomic integrity in the system is not working as well as it should be. So today they're a lot more symmetrical and a lot longer in duration as well. So they're about 5 seconds now in both eyes, whereas when you first came in, about 2 seconds. So longer duration and endurance with pupillary fatigue. Still need to work on a couple things with the vestibular system, but that should clear up nicely with the exercises. We've seen some good improvement over the week, particularly with the nystagmus, but we still have some work to do left just to further normalize that. When we're looking at how we're perceiving the environment around you, which as somebody who suffered from a concussion, what happens often is because you have those rotations that occur around the brainstem, basically that throws the system off in terms of calibration, and you're unable to really perceive your environment around you appropriately. So in other words, when you're standing upright, you don't necessarily perceive gravity as being upright and vertical. You might perceive it as being off from one side to the other and things like that. So that affects how you perceive space around you and how you perceive depth and things of that nature. One of the tests that we use for that is that finger-nose-finger test. So you should be able to map out the environment around you, so you should be able to touch my finger repetitively, knowing exactly where it is with your eyes closed. When you first came in, there was some dysmetric movements, which basically means that you missed the finger 4 out of 10 times, so you only were able to touch the finger 6 out of 10 times. And now we see that you're able to do it 9 out of 10, so that's within normal limits, which lets us know that how you're perceiving the environment is a lot more appropriate than it was before. And when we're also looking at things that could impact something like nausea, especially somebody who is looking at their phone or reading a lot and things like that, when we're looking at convergence, we saw that the left eye was not coming in towards your nose when you were looking at things up close. So that can produce double vision, and I know that's not necessarily something that you were experiencing, but it could manifest as something like nausea as well. So anytime you're looking at something up close, which nowadays, people being on their phones and everything is really all the time, that can cause some symptoms and flare-ups as well. So we see now that that left eye is moving in a lot more appropriately compared to when you first came in too. And then when we're looking at some other eye movements, how you were tracking looked pretty good, but the downward movements, which I know you were saying you've had some trouble with in the past, there were some abnormal findings there on Monday, and today everything looks to be pretty good in terms of the downward eye movements. Also, those optokinetic reflexes, remember we were saying in the full field, we still have some work to do in the vertical plane, but even on Monday in the small field, we were still experiencing some abnormal reflexes with that in the vertical plane, whereas today in the small field, they're still looking really good. So all we have to work on left is the big field or the larger field. And the last thing as well is when we see a lot of these foundational things improving, like for example, perceiving the environment appropriately, autonomic function, and things like that, cognitively you tend to do better as well. And I know that that didn't reflect in the testing per se, but when we're measuring some of the other things in the exam here, when I'm wiggling a finger, you have to look at the opposite finger. It was taking you a decent amount of time to make that decision on Monday. It took you a couple seconds to think about it and then react. Whereas now, they're pretty much like split second. As soon as I moved a finger, you immediately look the opposite way. So we're seeing that response time is improving too. So overall, I think we saw some pretty good changes. And then again, the real thing that we really wanted to focus on was getting rid of that nystagmus, which we were able to successfully do this week. So I think that's going to help tremendously, especially with nausea as well. Do you have any questions at all?
No.
Okay. Well, we're going